Hello, good evening. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to our weekend open clinic. Today's clinic is important for so many reasons. Now, if you are believing God for babies, one of the things you look forward to every month is pregnancy. Now, conventionally, there is only one way to confirm you're pregnant: your test. You practically have 3 different tests you can run to know if you're pregnant. But what we're going to talk about today are more like things that will give you hopes, things that will cement your faith when you're believing God for babies. The weird signs and symptoms you can actually have, which ordinarily some people might not even relate to pregnancy. But generally, if you have any of these early pregnancy unusual signs, it's possible you're pregnant. Now, a couple of things. You might be pregnant and it might be too early to detect the pregnancy hormone in your urine. If you're using blood is more superior to urine. So I'm going to take time to enumerate the unusual early pregnancy signs, which might actually be weird, but they might be an indication that you're pregnant. But if you have any of these symptoms, it doesn't categorically mean you are pregnant. The only way for us to confirm you're pregnant is to go for your urine test, go for your blood test, and go for your ultrasound. Ultrasound is the clinical evidence of pregnancy. So sit in, make yourself comfortable, announce your name. I'm anticipating a couple of medical students joining us, then COO will join us. If you're a medical student under me, please indicate your name. I need to know your real name, and I want you to participate fully, especially if you're offering OBGYN posting. That's obstetrics and gynecology. I want you to participate fully because part of what I will teach you guys every day is actually the tenets of what you will learn when you start your gynecology and your obstetrics posting. So if you're currently a medical student, you're in this clinic right now, please, I need to know your name and I need to know your level. Very important before I start. COO, thank you so much and welcome. Now, immediately after this clinic, I'm going to repeat another clinic in our Facebook. It's going to be on our page. Remember the big event coming up on the 24th. If you are believing God to have twins, triplets, quadruplets, it's possible in 2024, but you need to gain the knowledge. We are going to share the basic knowledge you need on the 24th, so make sure you register for that event. So I can see Ezinne. Ezinne is from my medical school. Thank you so much for coming from Nnewi. I want every other person out there, medical student under me, to please indicate before I start. COO, thank you so much. Buhari, thank you so much. I need to know your school. Very important. Okay. All right. So today we're talking about unusual, weird, early symptoms of pregnancy you can actually present with. And it might be a good sign that you're actually pregnant. So many people want to become pregnant, but they get so worried whenever they see their period. I'm going to use my teaching aid to illustrate when need be. Now, like I mentioned, the most important thing to do to be sure to have a peace of mind in pregnancy is to go for your pregnancy test. You have 3 tests. The first one is urine test. Your urine test is a qualitative test. Quality means pregnant or not. That's the urine test. Now, I will advise you to allow 7 days beyond your anticipated period. If you miss your period for 7 days, that's the ideal time to go for pregnancy test. If you go before 7 days, you might be pregnant, but you might get false negative test. So allow 7 days beyond your missed period. By the special grace of God, you're going to get a positive result. Now, it's not enough to rely on urine test. Urine test is not confirmatory. You have to step up your game. You book an appointment and you go for your blood test. Your blood test is also checking the beta HCG, beta human chorionic gonadotropin, the so-called pregnancy hormone. But your blood test is superior in the sense your blood test will give you a quantitative level of the beta HCG hormone. It's expected that if pregnancy is going okay, every 72 hours, your beta HCG will double. Now, the unusual signs that some women will have early in pregnancy that might actually be consequences of the hormonal changes that happen in pregnancy can be nosebleed. Majority of pregnant women will start noticing nose bleeding very early in pregnancy, as early as 4 weeks. Some women will begin to suddenly start experiencing headaches. Changes in the hormone in your body when you're pregnant, especially estrogen and progesterone, can increase different statistics, different dynamics in your blood system, in your cardiovascular system to predispose you to having headaches. Majority of women that are pregnant will also notice mood swings and a couple of other symptoms. So most of these symptoms you're going to experience in your first trimester. Remember that pregnancy is divided into first trimester, first 3 months, second trimester, second 3 months, last trimester, last 3 months. An average pregnancy is supposed to last for 42 weeks, approximately 9 months. Once it's gone beyond that 42 weeks, we must deliver you by all means possible. So the major reason why we might be having all this is because of significant hormonal changes that happen during pregnancy. Some of those signs and symptoms might be positive, some of them might be negative, some of them might make it very, very uncomfortable for you. So most people are just aware of the common pregnancy signs. So the common pregnancy signs that people always look out for is vomiting, which we call early morning sickness, missed period. So missed period, it's not all the time you miss your period that means you're pregnant, but you need to go for test. So there are potential signs and symptoms you might likely have, which will not be unusual. Which will not be usual. They will be unusual. They will be weird. You might not even understand it. You might be thinking that something big is happening. I've already mentioned nose bleeding. Nose bleeding is very common very early in pregnancy due to hormonal changes, especially the influence of progesterone in pregnancy. Nose bleeding most rarely will just resolve on its own. You're not supposed to freak out about it. Number 2, mood swings. Generally, women have mood swings around their cycle. There are some women that will notice few days to their period, they will just be irritable for no reasons. There are some women that will be very happy in the morning, very sad in the evening, not because there is a particular thing making you sad, but it's all part of the hormonal changes in your body. You need to be careful. What I'm telling you now doesn't mean you are 100% pregnant. It's just a likelihood of early presentation of your pregnancy. So mood swings, it stopped there. Pregnant women may feel more emotional than unusual. So heightened emotions are perfectly normal at any time, but you will notice a pronounced swing in your mood when you are pregnant. I've already mentioned headaches. Majority of women that are pregnant will experience headaches during the early phase of that pregnancy, mainly due to increase in the estrogen level. So estrogen will increase during pregnancy, and somehow estrogen will lead to a couple of changes in the blood vessel that will lead to increase in the blood volume. And when that happens, you might be predisposed to having headaches. Some women that are pregnant will also notice increase in stress and fatigue, which can cause tension headaches. There are different types of headaches. So the majority type of headache you might likely have in pregnancy might be tension related. So you need to avoid stress by all means possible. But here's the deal. If you notice that your headache is being there, persistent, and somehow you notice that you have generalized body swelling, and you probably went for your ANC, and we notice that there's protein in your urine, you might likely be predisposed to having preeclampsia. You need to follow up with your healthcare provider. So a combination of increased blood pressure, presence of protein in urine, generalized body swelling, which we call edema, is indicative of preeclampsia, which is a pregnancy complication that can be very deadly if it's not properly handled. Majority of pregnant women will also notice dizziness. So what might lead to dizziness in early pregnancy? Most women might feel kind of different fluctuations in their blood pressure. So there are times, especially in the morning, when you wake up in the morning as a pregnant woman, don't quickly just jump out of bed. Gradually bring your leg down, put your hands in the bed for some seconds before you step out. Don't quickly get up from bed in pregnancy, because if you do that, you might have a sharp drop in your blood pressure, which will lead to the vessels to open up and more blood will go out or leave the womb, and you might feel dizzy. So reduced blood pressure can lead to dizziness, which can occur due to fatigue, low blood sugar, and stress. So be careful. You need to eat well. So you need to eat small, regular meals. Small, regular meals, regular, healthy meals. Now, you will also notice some likelihood of increase in what you guys call pimple, which is acne. Acne might be an early sign of pregnancy in some women, and this might also be related, to a couple of other changes in your body. But most women will notice some distribution of acne in their body, which prior to now, they might not really be predisposed to having acne. The likely period you would have had acne will be in your adolescent phase, but over time you overcame acne, so suddenly you begin to see blackheads here and there. Now, how can you take care of this if you're actually pregnant? Wash your face twice daily with mild cleanser, lukewarm water. Don't go pricking and squeezing the acne pores to make sure you don't get secondary infection. Choose oil-free cosmetics. Check with your professionals to make sure that everything is good. Now, majority of pregnant women very early in pregnancy will notice strong sense of smell. Strong sense of smell is also a likelihood, very weird, but it might be a sign that you're currently pregnant. This might present because of increase in tolerance and decrease in tolerance. So there are some smells you're very good, in adapting to. Then there are some smells that will actually lead you to vomiting and all that. If you notice this suddenly and you know you're believing God for a baby, it's possible you're pregnant. Now, strange taste in your mouth is called dysgeusia. It can happen in some women. So we believe that hormonal changes can also lead to this. So some women will notice kind of metallic taste in their mouth, and they will notice increase in production of saliva. Completely okay, completely kind of things that will happen when you're pregnant. And of course, you will notice an increase in propensity of your vaginal discharge. Now, it's expected as a woman that you will have normal, clear discharge, not itchy discharge. So if that discharge is not clear, if it's copious, if it's smelly, if it's blood change, if it's any color, please ring your doctor immediately. It might be a sign of infection. Now, majority of pregnant women will notice an increase in craving for particular food and avoiding food they previously used to like, and suddenly they begin to crave for things, especially things that are not of nutritional value. So the foods you once loved might suddenly be repulsive, and the foods you never even think in your life you're going to like, you start waking up by 2 a.m. to go and look for a particular food. Some women might actually start craving for non-food items like ice, like sand. That condition is called pica. Now, some women will also notice increase in fatigue. Increase in fatigue might be the only sign you're pregnant. It can happen in your early pregnancy. It's also due to hormonal changes. Some women will notice increase in shortness of breath. The increase in your hormone progesterone can occur in the first few weeks of pregnancy and can make you to feel like you're out of your breath. So this is also as a result of hormonal changes. So shortness of breath can also present as sign of pregnancy. Congestion, nasal congestion, runny nose, feeling like you're not breathing properly is also a likely sign you might be pregnant. Constipation. Constipation can also be a sign of pregnancy because of hormonal changes during pregnancy. Also, progesterone. So if you notice, there are two hormones that we've implicated here, progesterone and estrogen. They are the chief hormones that will make a woman to be a woman, have normal pregnancy, and have good outcome. When your progesterone level is low, likelihood you're going to miscarry that pregnancy is high. Now, when they are doing their good stuff, sometimes they can have side effect or some adverse effects. So constipation is not unusual in pregnant women. So what are you supposed to do when you're constipated in pregnancy? Drink a lot of water, eat a lot of fruits, eat a lot of foods that have fiber so that you can be regular. If there is anything to avoid during pregnancy, is constipation, because when you're constipated and you go there and you're straining to move your fecal material out of your body, you can predispose yourself to developing hemorrhoids, which you guys call pile. So very, very common. Now, generally, if you have any of these symptoms I've mentioned, just so you be careful, it doesn't mean you're pregnant. So don't go and misquote Dr. Chudi. It means you might be pregnant. Now, what's the next thing to do if you notice any of these symptoms? You go to your doctors, or just go for your urine test, then go for your blood test, then go for your ultrasound test. Remember, until you've checked your ultrasound, until we've seen the evidence of pregnancy, you are not clinically confirmed pregnant. You have what we call chemical pregnancy. So we must confirm all pregnancies. So when do you see a doctor Once you notice any of these symptoms I've mentioned and you've missed your period and you know you want to become pregnant, then please ring your doctor. Now, the fact you have all these symptoms, I'm going to repeat again, doesn't mean you have been confirmed pregnant. Some women can also present with these symptoms I mentioned during bleeding, during ovulation, and shortly before period, which we call PMS, premenstrual syndrome. So there is a very thin line between some symptoms and presentation that some women can develop, which might be a sign of some gynecological problems. So the fact you have all these signs I mentioned should not give you that confirmation for you to go and start throwing party. Go and confirm, run your blood test, run your ultrasound test. Once it's confirmed you're pregnant, then register for your ANC immediately. Remember, there's an overlap between premenstrual syndrome, side effects of some hormonal birth control, and early pregnancy symptoms. So things like constipation, headache, feeling tired, mood swings can also present in premenstrual syndrome, can also present as side effect of some drugs you're using. So the only way for us to confirm that you're pregnant by sure is to go for test. And the only person that can oversee your test is your ANC doctor. Okay, so that's my presentation. I'm going to open the clinic now. And I will encourage you to start asking your questions. So please feel free to ask all your questions, especially from the medical students. Feel free and ask your questions. COO, I expect you to ask top clinical questions. I want you guys to challenge me. And join me in Facebook immediately after this. Medical students, start asking your questions. If you're in attendance, announce your medical school. Announce your level. Then start asking questions. You cannot attend my clinic without participating. I'm going to give you a strike. So please ask your questions. I'm waiting for your questions. Okay. So I have Ezinne from my medical school. Then I think Tammy Too Sweet. I don't know if you're a medical student or not, but you've been regular. You better confirm your identity. So I have Imiran Buhari. I need to know your Buhari. I think you're from Udusok. Then Kelvin from Federal University in Ikwo. That should be medical school. Alexa Kweme Medical School in Abakaliki, Axis in Ebonyi State. So start asking your questions. Everyone, please. Ask your questions real time. I'll provide you feedbacks. You need to know this. You need to be able to explain to people what they need to do, what they should actually know as a top shot medical doctor to be. Go ahead, ask your questions, please. We have 3 minutes before we end the clinic. Ask your questions. Kelvin, you're welcome. I'm anticipating your questions. COO, you can also ask me questions. You can coin questions like you normally do and ask me questions and I'll give you a feedback. 2 minutes before I go. Okay. Okay, yeah. Craving for Nzu. Nzu is a non-nutritional stuff that some pregnant women crave for. It's an example of pica. Now, how can you overcome this? Now, there are certain things you really need to use your subconscious and you need to be intentional about it, because the problem with taking all these non-nutritional items is the fact that they can lead to anemia. So they can go and block a couple of receptors that will allow your body to perform optimally. So you probably just need to change your behavior. It's going to be the conditioning. You're just going to make conscious effort to stop taking them and start replacing those non-food items. So like I mentioned, you eat regular small meals, regular small healthy meals. Just have all those healthy snacks, healthy fibroid stuff, healthy fruit, healthy vegetables, so that anytime you feel like taking the ice, or you feel like taking sand, or you feel like taking nzu, you replace it with taking your fruits. So it's going to be conditioning behavior. You have to condition yourself. You have to understand the reason why you're not supposed to take it, because it can affect your pregnancy adversely. And now remember, during your pregnancy, your immune system is very, very low. So when you begin to pick all those non-food items from poor hygienical setup, you can introduce infection in your pregnancy and you can have a very bad outcome. So you need to put in efforts to stop them. Is implantation bleeding heavy or light? Very, very light. Implantation bleeding is just the bleeding that will last about 24 hours. When the fertilized egg, which is called an embryo, it's developing for the first time in the endometrium. So remember that pregnancy will happen in the tubes. Then after the fertilization of the egg, which will form an embryo, they will travel down and start developing in the womb. When you get to the womb, the cover of the womb is called the endometrium. So for some women, when this development is happening in the womb, they will bleed. Very light bleeding. Very, very light, that should last for about 24 hours. And it's pretty much normal. It's not all women that will experience it. But all other forms of bleeding in pregnancy is a danger sign. You must report to your doctor immediately. Good evening, doc. Is it possible for someone to do urine test, come out negative, but went for blood test and come out positive? Yes. Now, if you're pregnant and your urine test didn't peak your pregnancy test, then we need to go and redo that test. It's false negative test. Possibly the strip or whoever did the test didn't do it correctly, because if you are pregnant, first of all, your pregnancy will show in the blood. So blood test is superior to urine test. Your urine is just ultrafiltration from the beta HCG that came out from the blood. So the first place to report positivity in pregnancy is in the blood before it gets to the urine. So if you're pregnant through the blood, it's expected that your urine will also show pregnancy test, because you're checking for the same hormone. You're checking for human chorionic gonadotropin. That's what you're checking. So you can't be pregnant and your urine is negative and your blood is positive and your ultrasound is positive. The three of them must be positive. This is an area you need to be careful. There are so many fraudulent people out there that will go and give you other people's babies and tell you, hey, please don't go for ultrasound, because they know fully well you're not pregnant. They're just scamming you. Everybody currently pregnant must have that evidence in the womb. If we don't see the evidence that you're pregnant in the womb, then likely you might have ectopic pregnancy. We must find that pregnancy and we must know what to do with it, because all positive pregnancies must show in the womb. The sac must be there. The gestational pole must be there. That's the clinical evidence of pregnancy. Okay? All right. You'd like to know how nosebleed can occur as is part of the hormonal changes in estrogen and progesterone. Couple of changes in your blood vessels, couple of changes in the blood dynamics during pregnancy can lead to all these little hemodynamics that will lead to nosebleeds. Tiny vessels in your nose will start having changes in their hemodynamics and you can bleed. But it's all negligible. It's not something you should worry about. Okay? All right. Most pregnant women have nausea and vomiting. At what point does one know it's serious enough to seek medical help? Of course, if you're not retaining any fluid, if everything you have in you is coming out. So fluid management in life is all about garbage in, garbage out. So if you vomit, if you sweat, if you have diarrhea and you're replacing it, and you don't have all those telltale signs of, dehydration, then you're good. But when you cannot retain any fluid, let me give you an example. You wake up in the morning, you've been vomiting since morning, and you were not taking fluid, you're not retaining any food you want to take, you vomit them. Any fluid you take, you vomit them. So if predominantly what you've been doing within the first 24 hours is to lose all the fluid in your body, then you're likely dehydrated. You have what we call hyperemesis gravidarum, excessive vomiting and nausea, which can happen during pregnancy. You must present to the hospital immediately, because dehydration is one of the things we want to avoid in pregnancy. So that's the point you need to start heading to the hospital. But before then, you can prepare your oral rehydration solution and replace it. Anytime you lose any fluid in your body through diarrhea, through vomiting, those are the major areas you can lose fluid, but there are a couple of other areas you can have insensitive fluid loss. You have to replace them. Anytime you're sweating, you're losing fluid. So that's why we encourage you to drink a lot of water. Okay, I love that question from Kenneth. What's the estimate of the possible nose bleeding? I've already mentioned is hormonal changes that happen in pregnancy. I don't want to go into details there. At what point does not, excessive, there is no cutoff point. You just, a diagnosis of exclusion, personal, history taking, then frequency of the number of times you've lost a lot of fluid, and the fact that you can't just carry on with the activities of daily living, and you've been vomiting for the past 24 hours excessively, and you're just in your first trimester, then it's a cause for concern. So there is no hard and fast rule of where to draw the line regarding hyperemesis gravidarum. but it's a clinical diagnosis we will have to take. It's good to err on the side of caution than to take chances. So if you notice, if you feel that, the ORS and all those stuff you're taking is not doing nothing for you, then you head to the hospital. Thankfully, there are some drugs we can give you to stop the vomiting. Okay? Correct. What effects does thyroid hormone have on fertility? Heavy effect. Your thyroid hormones are very important in the metabolic process in your body. So your thyroid hormones must be within normal range. If you have excessive thyroid hormone level, it's called hyperthyroidism. If you have reduced thyroid level, it's called hypothyroidism. Both hypo and hyperthyroidism can affect your fertility. So that's why when we are running our hormonal test, we want to run all the hormonal panels, including your thyroid hormones, your T3, your T4, your TSH, okay? All right. What's the superpower that experienced mothers have that helps them pick up these things in their pregnant daughters as soon as possible? Experience, instincts, natural instincts. There are certain things your mother will see in you and she will call it, and she's perfectly 100%. It comes from experience. It comes from motherly instincts. But remember this, no two pregnancies can be the same. You can actually have 5 babies, and those 5 babies would have presented differently. There are some women that will have a tiny belly and they'll bring out very big baby. And there are some women that will have very big bump, and they bring out tiny baby. So each pregnancy is unique. So the fact your mother or your grandmother can, look at the symptoms of how you've been doing about your stuff, and they can predict you're pregnant and you might actually be pregnant, doesn't mean you have to depend on, that particular route of diagnosis. You have to follow the medical line to make sure your pregnancy is looked after. But no two pregnancies can be the same. So don't use the fact that, I've had 5 kids and I can predict everything that will happen in this index pregnancy. It's not true. Each pregnancy is a very big challenge. So it must be treated on its own merit. I love that question. Buhari, thank you. Is headache associated with pregnancy have any special characteristic? Like I mentioned, most headaches you will experience in pregnancy, it's based on that 2 hormones, estrogen and progesterone. They all combine to go and, kind of distort a couple of the hemodynamics you have in your cardiovascular system. Then also you might be prone to poor sleep, little stress here and there, which can lead to tension headache. So, and some women can also experience migraine headache during pregnancy. So it depends on what's unique to you. And of course, you have to be on lookout for preeclampsia. Okay? All right. Since we are just hovering around 27 minutes, I actually love the fact we have a lot of interactive session from the students. So you can go ahead and ask more questions. I will have extra 3 minutes to spend. If you have not asked any so far, I've seen Kelvin, Buhari, Ezine, and who else? If you're a medical student and you've not asked any question right now, you did not attend, and I will count you against you. It's better you didn't show up than to show up and not participate. I always want you guys to participate because this is my opportunity to teach you guys. You had nausea, you have vomiting all through your first pregnancy, your baby girl, currently pregnant with your second child, and a few different, correct? Each pregnancy, there are some babies that will kick your butt from day 1 to the last day. And there are some babies you won't even remember you were pregnant. Before you blink, you go into labor. So each baby, I remember my son and my daughter presented opposite of Dumeje. Dumeje started from day 1. Every day my wife would be complaining that this baby is kicking the hell out of him. And when the guy came out, we noticed that the guy is always running up and down. So each baby is unique. Okay? Can you be pregnant and still be seeing your period? No. All bleedings during pregnancies must be considered abnormal. They are all classified as threatened miscarriage, threatened abortion until proven otherwise. All. The only normal bleeding in pregnancy is that implantation bleeding, which should be a light bleeding, which should resolve within 24 hours. Any other form of bleeding is considered abnormal. So I know some women would have presented to you and say, oh, doc, I was pregnant and I was bleeding throughout my pregnancy. I was seeing my period. It's completely called abnormal bleeding in pregnancy. Be careful. Seeing blood in pregnancy is something that will wake you up because it might be a sign that you're just about losing your baby. So threatened pregnancy will start with bleeding, with pain, and some women will have water coming out of their vagina. Then over time, it's going to go to inevitable abortion, inevitable miscarriage. So if you graduate from threatened to inevitable, it means, unfortunately, you're going to lose that pregnancy. Fortunately, there are a couple of things we can do by ourselves to see if we can prevent miscarriage from happening. Unfortunately, majority of the miscarriages will happen because they are chromosomal abnormality. The body wants the best. When the body is not getting the best, the body will just allow the baby to leave the body. The body always wants the best. So always, I know majority of women will feel bad when they miscarried, but I tell you this, if that baby you miscarried were to come alive, they will not have compatibility with life. There are so many babies that would have had extreme problems if they were not aborted. But at your stage as a mother, you will not understand my explanation. But majority of the pregnancy losses you had was a way of the body to perpetuate and have the best. If the body is not getting the best, the body is expelling that baby. Okay? All right, guys. So we've come to the end of the clinic. It's just about 30 minutes on that. Now, if you have a moment, still the medical students, hop in my Facebook group, my Facebook page, and we continue the conversation there. But if not, I will see you guys in our WhatsApp group. Thanks for coming. CEO, thank you so much. And remember to register for the event coming up on the 24th, Multiple Pregnancy Mega Masterclass. You don't want to miss it. So I know some of you are not into any relationship, but if you happen to know anyone that is currently looking for babies, they can become twin mothers. They can become triplet mothers. They can become quadruplet mothers by this time in 2024. Majority of the women that will have multiple pregnancy will receive assisted reproductive technique. Thank you guys so much and have a good evening. Bye-bye.